Today, let us discuss about Cefixime. Cefixime is a cephalosporin antibiotic. It belongs to third generation antibiotic. It is bactericidal. It is derived semi-synthetically from marine fungus Cephalosporin acremonium. It is active against gram-positive and gram-negative bacteria. It is available in tablet, capsule, suspension form. It is an oral antibiotic. Mechanism of action. Coming to mechanism of action, cephalosporin bind to penicillin binding protein which is present on the bacterial cell wall. This results in inhibition of transpeptidase, which is responsible for cross-linking of peptidoglycans in the bacterial outer wall. This results in rupture of the bacterial cell wall, which results in the lysis of the bacteria and finally leads to the death of the bacteria. This is the mechanism. Cefixime only acts on bacteria, doesn't act on viruses and fungi. Dosage forms and strengths. In capsule form, it is available as 400 mg. In tablet form, it is available as 100 mg, 200 mg. In oral suspension form, it is available as 100 mg for 5 ml, 200 mg for 5 ml, 500 mg for 5 ml. Indications: acute exacerbation of chronic bronchitis, indicated in the treatment of acute exacerbation of chronic bronchitis caused by Streptococcus pneumonia and Haemophilus influenza. Dose is 400 mg per day, prescribed orally in single daily dose or 2 times in a day. Otitis media, indicated in the treatment of otitis media caused by Haemophilus influenza and Streptococcus pyogenesis. Dose is 400 mg per day, prescribed orally in single daily dose or 2 times a day. In case of pharyngitis, dose is 400 mg per day, prescribed orally in a single daily dose or divided 12 hourly. In case of uncomplicated gonorrhea, if ceftriaxone is unavailable, then in case of complicated conditions it is used. Dose is 400 mg, prescribed orally. A combination therapy is given. It is given with azithromycin 1 gram, prescribed orally once, or azithromycin is replaced by doxycycline 100 mg, prescribed orally 12th hourly for 7 days. In case of uncomplicated urinary tract infection which is caused by Escherichia coli and Proteus mirabilis, dose is 400 mg per day, prescribed orally in a single daily dose. In case of typhoid fever, dose shouldn't exceed 100 to 200 mg 2 times. For treatment should be continued for 7 to 14 days. In case of renal impairment, if creatinine clearance is greater than 60 ml per minute, no dosage adjustment is necessary. If creatinine clearance is 21 to 60 ml per minute, dose is 260 mg per day, prescribed orally. If creatinine clearance is less than 20 ml per minute, 200 mg per day, prescribed orally. Treatment of infections due to Streptococcus pyogenesis, Cefixime should be administered for at least 10 days. In general infections, Cefixime dose is 400 mg once a day or 200 mg 2 times a day. For children, dose is calculated on body weight. The dose is usually 8 mg per kg of body weight per a day, taken as a single dose or divided in 2 doses. Side effects: diarrhea, abdominal pain, agitation, black stools, blistering, peeling or loosening of the skin, blood in the urine, chest pain, clay colored stools, coma. The most important serious side effect of Cefixime is diarrhea. Cefixime is contraindicated in patients with cephalosporin hypersensitivity, anaphylactic reaction including shock and fatalities. Drug-drug interactions. If cefixime is given in combination with the following drugs, cefixime level is increased or it may interact with the other drug and causes serious side effects. Some of the examples are amikacin, warfarin, ethinyl estradiol, vaccine, furosemide, probenecid. It is better to avoid these drugs along with cefixime. Some disease interactions are also found with cefixime. For example, in colitis, cefixime can kill the helpful bacteria in stomach and leads to diarrhea. In this condition, cefixime should be used in caution. In some conditions, it leads to inflammation of inner lining of the colon. In case of kidney disease, cefixime is usually filtered by the kidneys and excreted through urine. In case of kidney disease, there is an increased risk of kidney damage by using cefixime. In case of some lab investigations, cefixime gives false results. For example, in Coombs test, the Coombs test is used to detect antibodies that against the surface of red blood cells. A false positive test is obtained while taking cefixime. In such conditions, drugs should be avoided and tests should be performed. In case of urine ketone test, this test measures the ketone levels in urine. Cefixime may give false positive result for ketones in the urine test using nitroprusside. Some special precautions have to be taken while taking cefixime. Some of the conditions are allergic skin reactions. Cefixime causes allergic skin reactions, skin rash, swelling, severe itching. In such cases, drug should be stopped or dose should be adjusted. Antibiotic resistant. If the course of treatment is discontinued, in such conditions resistance will develop. Clostridium difficile associated diarrhea. Cefixime can cause diarrhea because it may kill the helpful bacteria in stomach, which leads to increased toxin released by the Clostridium bacteria. Driving. Cefixime causes dizziness, confusion. Do not drive a vehicle while feeling discomfort. Liver diseases. Cefixime may increase the liver enzyme and cause the liver swelling. Immune mediated hemolytic anemia reported. Monitor hemolytic parameters during and for 2 to 3 weeks after therapy. Discontinue therapy if hemolytic anemia occurs during treatment. Cefixime poisoning. In case of cefixime overdoses, symptoms include blood in urine, diarrhea, nausea, upper abdominal pain, vomiting. Antidote. There is no specific antidote for cefixime poisoning. Gastric lavage is performed. Dialysis will not remove cefixime in significant quantities. Treatment of cefixime side effects. In case of diarrhea, advise the patient to drink plenty of water to replace lost fluids. In case of feeling sick and tummy discomfort and indigestion, advise the patient to eat simple food. In case of headache, drink plenty of water and use a painkiller. Feeling dizziness, advise the patient not to drive until the patient feels comfort. If side effects progress, advise the patient to stop the drug abruptly. Thank you.